All right, team. Well, people are signing on, so thank you for joining us today. So just normally what happens, not everybody signs on at exactly the same time. So when you sign on, just mute your microphone, and then as the program begins, if you've got questions, all you have to do is unmute your microphone and shout it out. The other thing you can do, just as a reminder, is to you can hit that little chat bubble, and that's always and then you can kind of type in your questions, and we'll try to read them and shout them out for you. But feel free to interrupt us. We really do want this to be a time of interaction and conversation, and and uh, and so thank you so much for joining us today. I'm gonna stop the share here. Everybody's signing on. Everybody's being good meeting participants today. They're signing on and muting themselves. I see our guest has arrived, uh, Attorney Rebecca Kapusta. Thank you for joining us today, Rebecca.
Good morning. My pleasure. Thanks for having me.
Well, thank you so much, and we'll get started. It's kind of unique when you schedule one of these meetings. Not everybody's clock is exactly synchronized, and so fortunately, I get a little beep when people sign on, and so I call this part of our meeting Roy just jibber jabbers. I remind people to mute their device, and then if they have a question, just unmute and interrupt us and shout it out. We will try to have a time for questions at the very end. But people shouldn't feel any pressure to wait to the end. I like as much interaction as we can, and but we'll get started in just a couple minutes as more people are continuing to sign on. Give them a little bit of time here. So thank you everybody for joining us today on this historic day. If you're like me, I've got two screens up. I've got my TV screen to the right and my primary screen straight ahead of me. So if you see me peeking over every once in a while, I'll be watching our new president raise his hand and do that thing. But a historic day. I'm kind of one of these old school guys that says, nope, if we've got our thing scheduled, the show must go on. And so we went ahead and kept our Wednesday lunch and learn at this same, now I'm dating myself, same bat time, same bat channel. If you grew up like me in the 60s or 70s, you'll get that. If you're a young person like Rebecca and Kelly and Pam and a few others, you won't get that at all. You'll have to Google it to figure out what that means. But again, thanks for joining us today. I'm going to go ahead and get things started. Want to first just again thank you, Rebecca, for joining us today. Um, Attorney Rebecca Kapusta is our Vice President for Community-Based Care. She kind of headquarters out of Hillsborough County, and is an incredible asset to Eckerd Connects. Um, she's according to a study at the University of Miami, Hillsborough County has had one of the highest concentrations of highly unstable children in the state. And Rebecca has just been so focused in helping these kids, really streamlining our program, rolling some of those lessons out into many of our other programs. Rebecca's dedication to these children just motivates her to lead teams committed to overcoming challenges. In her position, Rebecca coordinates, integrates, manages child protective services, and works to improve the system of child care. Rebecca, thanks for joining us today. We are so appreciative of you and your leadership on our team. We're so fortunate to have you. And your background is just amazing to me. I'm new to Eckerd, as most people know. I've only been here about it depends on how you add it up, but 16 months or something. But you guys let me peek in on a working Facebook group that you had, and I was just so motivated each morning watching you during COVID climb in the car to go do client appointments. I think you all were doing at the time driveway appointments, loading that lawn chair in the back seat or trunk, and just hearing you encourage your team it really was inspirational to me. Um, I like to kind of start things out. I'd love for you just to tell your story. I mean, your background is just amazing. Your uh, appointment as actually interim secretary at DCF before you came to work at Eckert, and being department's general counsel, and just a wealth of experience. And I kind of want to throw this out. I mean, how does somebody from a graduate of UCF and Stetson Law School grad move into social services and do what you're doing now? I want to hear about your heart, and I want to hear how you got pulled into this child welfare space.
Well, first, let me say thank you for having me here today, and thank you to everyone on the line for taking time out of their busy days to listen to us chat about social services here in Circuit 13. And I hope that Chris Card was on the line when you gave that very wonderful introduction. I really appreciate that.
I see Chris here. He probably wrote it.
But thank you again, and thank you to everyone on the line. So, when I came out of law school, I did not originally go into child welfare. I was in private practice, and I did take on some cases where I represented some parents in child welfare cases. And as I became more and more familiar with the system and the process and the legal challenges and the families that we were serving, it became near and dear to my heart to want to transition over to doing and dedicating my time and my energy and my knowledge to child welfare, because at the end of the day, I really felt like if I can make a difference in a child's life and a family's life, then I have put my education, my time to good use. So that's what made me feel good about my work when I went home from the office on a daily basis. Now we're all in our offices in our homes. But it was.
Well, and really, I saw your office many days was in your car. So
yeah, I still feel like that from time to time. But nonetheless, I mean, just really that passion to help that family, help that child through what has to be the most challenging time in their life, really is what motivated me to continue on in child welfare.
very interesting. Wow. Well, talk to me just about the program. I think so often we assume certain things about the child welfare space and foster care in particular. But talk to me about what you're doing, what's unique, what's going on right now. Talk to me about how the kids are doing, how the foster families are doing. Just give us a big picture on the program itself.
In Hillsborough County, we have some unique challenges, and I probably not that unique. There are statewide challenges with some of the children and families that we serve. But we have some truly amazing stories and dedicated staff that go to work every day and say, how can I make a difference? Despite all of the challenges, and there are some challenges in our system, we have more children in Hillsborough County than most any other area of the state, to our neighboring system, which is over in Pinellas and Pasco counties. So that is a significant challenge with the additional fact that we are also underfunded in Hillsborough County in comparison to where other services are located around the state and the level of funding they have for the number of children in their care. So Hillsborough has a...
Let me interrupt you. Let's run down that rabbit trail real quick. Talk about, sure. And we may have some supporters on the line with us today. Obviously, we have people from some of our other programs, but walk us through the funding structure here in the state of Florida, and some of the little bit more about that challenge in particular that you face here.
So the funding for child welfare is statutory, and it is a formula that is put into statute that is divided across the 20 different judicial circuits in the state. And that funding is then it is provided to each CBC lead agency for the judicial circuit that they are located in. The funding is not consistent with the number of children being served. It is formula-based, and that formula has not changed since the inception of the statute and privatization back in 2001, with the final transition occurring in 2006 down in Miami-Dade County. So that formula has stayed in place. And so if you're a child coming into the child welfare system in Hillsborough County versus in Miami-Dade County, the level of funding to support the services that you need is very different and much less in Hillsborough County than down in Miami-Dade counties, where they serve fewer children in the system.
Wow, wow. And that formula was originally written 20 years ago. Unbelievable.
Yes. Now we have fought hard. Chris has been a champion working with the department and with the legislature to try to change that funding formula. We got close last year. It did not change. The department does have some recognition that formula is not the best formula to serve the children across the state. So we're hopeful that we might get some traction.
Sure. And I know, not just Eckerd Connects, but many nonprofits in this foster care space statewide are supportive of some of hopeful changes coming in the future. Talk to me a little bit. Now, I'll let you get back to the original question. Tell me what happens in the average day we could begin with just somebody on your team. Could be a caseworker. I kind of want to pull back the curtain and give people kind of an inside look at what goes on in our space and how we support children and families.
So, and this is what I love about being with Eckerd, is that I get to be a little bit closer to the children and families that we're serving here in Hillsborough County. And it is amazing to watch the great work that is being done. We have some tremendously talented folks in this area that on any given day, say a case manager gets up, day in the life of a case manager gets up, might start his or her day with a transport of a child to or from school, help get that child to the dentist, to a medical appointment, to court, help facilitate the needs of that child with respect to needing to get clothing or a laptop, or making sure that the child is signed up for extracurricular activities, facilitate visitations with the parents, with the siblings, making sure that the child feels safe and comfortable in their foster care placement or in their group home, making sure that if the child has mental health needs, that child is getting the mental health needs met, and that the child is understanding really what the roadmap looks for that child looks like, whether or not that child is going to be starting a transition to more visits with mom and dad, maybe an overnight visit, and making sure that all along the way that child feels comfortable and safe and secure with all of those steps. Also coordinating and communicating with the guardian ad litem if the child has a guardian ad litem assigned to them, working with the attorney ad litem if the attorney ad litem is assigned in that particular case, and also is prepared and understands what's happening in court. And also making sure that the child is educationally on track. So every day begins, with a different challenge. No one day looks the same as the next. And at any given time throughout any of those moments, of course, you might have an emergency come up. Maybe a child got sick at school, or maybe a child, it was injured or something along those lines. I mean, it's unpredictable and anything can happen along the way. So case managers have to learn to be nimble, agile, and respond to the day that is presented to them, despite all of the tasks that they might have set out to accomplish on that given day. So they are constantly playing a balancing act between, their role and the needs of the system.
Wow. Wow. It's a lot of moving parts in this process.
Absolutely. And particularly in Hillsborough County, where we are probably the most complex system in the country, given that we have case management and we have CPI performed by a different office, which here in Hillsborough is the sheriff's office. We have CLS, which is ordinarily in-house to the department. It is outsourced to the Office of the Attorney General. And then we have Eckerd and its subcontractors. So it is a very complex system, and all have to move together and work together to make these systems work.
Sure. And it's just amazing to me to see that many moving parts and everybody really trying to make the child the priority.
Absolutely.
So often it gets, you all are kind of in the middle. You're working with foster families. At the same time, you're working with the parent or guardians and seeing what sort of support we can give them to bring that family back together. What advice would you have, first of all, for foster parents? And then the follow-up question is going to be, talk to me about the guardians or parents themselves that are hoping to get their children back. I'd like just your thoughts on first of all, advice for the foster parents and the role they play in this process of helping these young children.
So foster parents are absolutely the backbone of our system. They have a unique role and opportunity to take kids into their home, into their heart, foster them, keep them feeling comfortable and loved, and just welcome in their homes, but have the hardest job of trying to get that child ready to go back home to their family, to their mom, to their dad, or their caregiver, whomever they were removed from. And so it is not easy. Be an advocate. That would be my advice. Be an advocate for that child in your home. Love them and care for them like they're your own. And you've done your role, and it is the most significant role in child welfare that we have. We have a process or a system in Hillsborough County, and it's actually not unique to Hillsborough County, but is one that we are working with in Hillsborough County called QPI, Quality Parenting Initiative, where we encourage foster parents to work closely with biological parents or caregivers from whom the child was removed so that they can support those biological parents. They can have a good relationship that will support the child. And so when the child is ready to transition back home, it's a comfortable and smooth transition. And the biological parents or caregivers have that warm hand and that connection that they can reach out to and call when something happens, or they might have a need or advice, or just that hand to keep them feeling supported and stable. So it is a really great process when it works to see the outcomes that we can put in place for children and families.
Okay, now the other side of that coin. What advice would you give to guardians or parents that where the child has been taken away, they're working on their home situation, working on certain areas of parenting that they need to improve upon? What advice would you give to parents going through that process and to make this all work?
It's not an easy system, but battle through it. Do everything you can and accept the supports that are there to offer those long-standing supports, you'll be in a better place when you get to the other side. And your kids will be better served when you get to the other side. Reunification is our number one priority in statute. And when we can get to reunification, that to me is my favorite day. So
Right.
many in child welfare say adoption is their favorite day. For me, it's reunification day, because when I see families reunified, I know we have done our job. And it is so amazing to see a parent, get to that other place where they are, able to take that child back in their home, to love them, to care for them, and to know that they have the supports in place they need to do it long term.
Wow. And you mentioned adoption, and again, that's not always the perfect solution. In some cases, because of the situation, and a child can't be returned to their parents, and so they're looking to be adopted, and we're looking for foster families that maybe could adopt. Talk to me about that process. What advice would you have for that adoptive parent or family? These are tough. See, I'm not throwing you easy answers for an attorney that wants straight up or down. No. He's asking me my opinions about stuff, my feelings about stuff. See, I have a secret goal, and that is to become a game show host one day. So I'm putting you on the spot, Rebecca.
Well, I think you are moving that direction very well. It's that whole word advice that's throwing me off. But as a lawyer, we don't like that word. Makes us a little bit wonky. But
yeah, but I know your heart, and I know the Eckerd culture, and this really is about how we care for people, and
absolutely.
And so please, again, what word of advice would you have for adoptive parents? It is. I think Chris Card told me last year, I think there were over 1,200 adoptions at Eckerd. Of course, that's broader than Hillsborough, but talk to me. What advice would you give those 1,200 new families?
So, every parent would say it. Youth don't come with a manual. There is no, manual book that's going to tell you how to raise that child. Love them, be patient with them. These children come into the system and come into their homes and their lives, having lived through very traumatic circumstances. And every child needs a home. Every child deserves a home, a safe, loving, nurturing home. And when reunification doesn't work, adoption is our next best choice. And it is truly amazing to watch Adoption Day down at the courthouse. Here this year, we didn't have it at the courthouse. We had it out in front of a family place, and it was a drive-through event. The judges were still there. The mayor was still there. And it was a really great event, despite some of the challenges that COVID presented. Last year, we adopted out 386 youth. We finalized 386 youth,
wow,
which is the highest number Hillsborough County has ever finalized. So again, despite some of the challenges, we really did have some true successes. But in terms of advice for a foster family that then becomes an adoptive parent, they're not unlike any other child. There is no guidebook, there's no answer book, there's nothing that's going to tell you how to handle that particular child. The best advice is just love them and let them be a child.
Oh, that's special. Well, you talked about, oh my goodness, drive-through adoptions in COVID 2020.
Yeah.
Talk to me just about how challenging 2020 was for you. Talk to me about how changes that you had to make in program services due to COVID. Um, uh, Share some of those experiences, because many of our supporters, many of our coworkers, really aren't aware of how you wrestled with many of those challenges.
So, you know, there were multiple challenges when 2020 began with respect to COVID and trying to find new ways to work. Initially, it was we're going to transition some of our staff to work from home. So those of our staff who had laptops and were able to, we transitioned them out of the office. Within days, it became we're transitioning everyone home. We need to find laptops. We need to image them. We need to get cell phones for staff that don't have cell phones. For those staff who cannot work from home or that have children in their care during the day and need to come into the office to be able to get their work done. How do we manage that? I don't want them to have to choose between their family and work. I want to give them the opportunity to serve both. So we had to navigate through all of those issues. Case managers had to find ways to visit with children in their placements with all the restrictions around social distancing and wearing masks and making sure they were safe. We had to find locations where we could quarantine youth if, in fact, we had a youth that needed to be quarantined due to being COVID positive or possibly exposed. And we needed to find several locations like that in the event that some of them were mixed gender or whatever. And then we needed to hire staff who were willing to stay with those youth and watch them despite the fact that they were either exposed or COVID positive. So we had to quickly shift some of our initiatives, shift our attention and our focus. Our staff were nimble and agile. I love to say those things because that's how you have to be in child welfare. And they stood up to the task. We still had staff coming in to do the fingerprints and background screening. We still had staff going out to families and doing home studies and interfacing with the general population. And they took all precautions necessary. Thankfully, we did not have a large population of youth that were needing to be exposed or that were COVID positive. From time to time, we've had some scares with needing that. We were fortunate to get youth tested right away and dwindle those numbers. And we've had a pretty healthy staff as well. So we have been fortunate in that regard, but it has not been easy. I think, you mentioned seeing on Facebook, I was transporting PPEs across, county lines to get to other CBCs so they could distribute PPEs to their staff. It was an all-out effort across the state. And I am never amazed at the work that continues, or I'm always amazed, I should say, at the work that continues to get done and how our team just reacts in child welfare always just says, I'm up for the task and we're going to find a way to get it done. So I could not be more proud to work with such a dedicated group of staff in Hillsborough County than I have been during 2020. It was truly amazing to see them just stand up to the task and get it done.
Mm. Well, as I said earlier, you and your team just inspired me, and a lot of times, whether I'm talking to donors, you didn't know it, but I was telling your story because I saw something on Facebook that morning. But we've got a few donors on the phone with us today, supporters of your program that come alongside and understand that there are things in addition to the government contract that Eckerd Connects needs in order to better serve these young people. And they come and they partner with us financially and support us. Many donate gifts in kind. They do a lot of different things, but it's kind of your chance. What would you like to say to the supporters of your program through Eckert Connects today?
We are, if we relied solely on the government contracts, we would not be able to serve the children and families in Hillsborough County. It is really, truly through the generous donations of our supporters, through, our community connections, that we are able to build clothing closets, get beds for youth that don't have beds to sleep in, to get backpacks for them. You hear stories in child welfare of how kids are leaving their placements and going to the next placement, and all their belongings are in a trash bag. And it breaks my heart every time I hear that story. And I have said, never in Hillsborough County will a child leave with their belongings in a trash bag. Now, some of them choose to do that, but it's through those donations that we're able to put on amazing events with kids that need to go to prom, that want to go to prom, that don't have the funding or the financial wherewithal to go buy that prom dress or those prom shoes and the jewelry and get the makeup done. And the boys come in and pick out their tuxedos and their suits, and they have a shopping event at a family place and really just do those things. But they have higher needs as well. I mean, some of them need those, all those essential items to make them feel like any other kid, normal. Some of them go to school and they feel labeled because they're a foster child, and they want to wear the same type of clothes as everybody else. They want to have the same haircuts. They want to have good teeth. They want to be educationally on track. And it's through those donations that we're able to make that happen for those youth, and make sure that they stay on track. And I think we have some pictures on our website of some of those youth and some of the events that they have. So if you have a chance, look at those pictures, because they will say it all.
Absolutely. I know the partnership with Raising Hope, and as you said, the rooms of hope that we have there, and clothing for emergency needs, and toiletry items, and school supplies, all those things go a long way. I always encourage donors as well. And I know some people like to go shop and bring things back. And that's fun, and there's a place for that. The challenge is literally every week, we have to go out and buy some things because a child has come through and we don't have it in their size. Shoes are a lot that way. Kelly Rossi will just find out what the needs are and go grab them and bring them to your center. So, those kinds of things are just so needed. That's why cash donations, you can go, right online, make those donations, designate them to Rebecca's ECA program. It helps us with so many things. Those school supplies, needs for moving into a new home. It really is, $100 can do an amazing amount of work to help a child in a new home, in a new family. $1,000 could help 10 families. And so it really is, these kind of things are so important. I know when Chris Card was with us a couple months back, he talked about the adoption needs that we often help with. And so often there are expenses, again, not covered in government grants, whether it's the home studies and a few legal expenses and things like that. $1,500 is about the investment we need to help to formalize one adoption. So there's lots of ways, just depending on where a person's heart is, that they can come alongside Rebecca and help her team fulfill their mission. Rebecca, just amazing job today. thank you so much. Just amazing work. It really you kind of pulled back the curtain and showed us a little bit of what goes in and around every day in your organization. And we're so thankful for you and your leadership, and just honored that attorney Rebecca Kapusta is heading this program and providing leadership for us. Thank you, Rebecca. We so appreciate you.
Thank you. Thank you for having me.
I want to remind everybody next week, Ashley Baldwin, our PG County Workforce Program Manager, is going to be speaking. And so please, please, please join us next Wednesday. Also, some of you may not know this, but on April the 10th, April is Child Abuse Prevention Month. Rebecca's team is joining forces with Kelly Rossi's team at Raising Hope, and they have Mile for a Child. You can go online, you can sign up, and you can participate in this walk. That's what I'll be doing, walking. I won't be running, although there are some people that run, but you can actually support Mile for a Child. If you have a business, you might want to sponsor Mile for a Child and help us underwrite the cost of that, and all the net proceeds go to help this critical program. So thank you so much. We appreciate everybody. Lots of comments, lots of input. Rebecca, you really touched our hearts today. Thank you so much.
Thank you.
All right, everybody. We'll see you next Wednesday.